My name is Sonia Michelle, and I'm Director of U.S. Studies here at the Wilson Center. And I'm very happy to welcome all of you to this conference on temporary migrant caregiver programs in Canada and Europe, models for the United States, ? The Wilson Center, as many of you know, but some of you may not know, is a living memorial to President Wilson. And in keeping with the spirit of his life, it's a place where scholars and policymakers come together to exchange ideas and talk about ways to approach major policy issues of the day. And the issue we're going to address today is one about which scholarship has been and can tell us a great deal, and also one about which policymakers probably need to act more creatively. For many years now, we've been hearing that the American immigration system is broken. Millions of people around the world are on waiting lists for immigrant visas to enter the United States, while millions more are already in this country, either legally or illegally. Yet policymakers and many immigration advocates seem to be locked in a stalemate. On one side are those who call for opening up immigration through amnesty for the undocumented and an increase in immigration quotas, while on the other side are those who are seeking to tighten the borders for reasons of security and restrict the number of foreign-born who can enter this country. And they also support systematically deporting those who are here illegally on grounds that immigrants, both legal and illegal, are competing with Americans in a time of high unemployment. This debate is generally, but not entirely, divided along party lines, and there seems to be little hope of resolving it any time soon, even though this week President Obama referred to immigration reform as a moral imperative. In my view, part of the impasse seems to derive from the fact that advocates on both sides are looking for sweeping change, either amnesty for all or deportation for all. And as such, both sides seem to be destined to come up against a brick wall as they encounter the polarization of the current political climate. And it seems to me that a more productive way to approach this is to look more closely at specific aspects of the current immigration system and try to think about how to address these specific aspects and perhaps find some common ground. And the aspect that I have in mind and that we're going to address today is care work. Today in the U.S., it is estimated that migrants make up at least a quarter of personal caregivers, whether for children, the elderly, or those with long-term or chronic conditions. And while many of the migrant workers who take care of these people are here legally, many, we really don't know how many, are undocumented. And while the demand for migrant workers in some occupational sectors is going down due to high rates of unemployment among U.S. citizens, the call for migrant caregivers seems to be holding steady. Again, we don't really know because it's very difficult to count this sort of thing precisely. The demand for paid caregivers in general can be explained by several factors. The continuing high rate of female labor force participation, nearly 60% in the United States, which includes many women who are responsible for the care of children, elders, or both. The aging of the U.S. population and the lack of public services such as child care and elder care. In the absence of either the women who traditionally provide care or public services to replace them, families are increasingly turning to the private, informal labor market to find caregivers. The demand for paid caregivers is one thing, but the demand for migrant caregivers requires further explanation. One reason is economic, because care may require many hours and thus be very costly. Families seek to hire those who are willing to work for low wages, and in many instances, those are migrants who are willing to work for less than native-born workers. Another reason is convenience. Migrants may be more willing to live in, thus providing families with coverage 24/7. And finally, sad to say, there's the issue of exploitability. Migrants, particularly those who are here undocumented, have little recourse when they are asked to work long hours at low pay or even no pay, since they risk deportation. Without adequate immigration quotas for caregivers, and caregivers don't fit in to the current categories for most of the work visas, many seeking to take up this kind of work will continue to enter the country illegally, and they will be vulnerable to exploitation. The U.S. is not the only developed country to experience high rates of female labor force participation, an aging population, and an insufficient supply of public care services. Thus, the employment of migrants as caregivers is, as you will soon hear, a growing phenomenon around the world. But some countries, as you will also hear, are handling this issue in different ways. So one of the purposes behind today's conference is to learn more about migrant caregivers and other migrant caregiver programs in other countries, specifically Canada and German-speaking Europe, and to see whether or not they might provide possible models for U.S. policy. That will be our first panel. The phenomenon of people migrating from the developing world to work as caregivers in developed countries is complicated by the fact that many of these migrants are women with families and caregiving responsibilities of their own. For this reason, it's important to examine the phenomenon from the perspective of both countries of origin and destination countries. Our second panel will examine the impact of migration on migrants' families, both in the U.S. and in their countries of origin. We will hear about what happens to the elders and families of migrants in Mexico, and we'll hear about access to health care among migrants and their families in the U.S. Finally, we need to understand how temporary migrant care worker programs might fit in with existing immigration laws and regulations. The U.S. has had such programs in the past, most notably and notoriously the Bracero program of the 1940s, 50s, and early 60s. Is there legal and regulatory space for such a program today? And what are the political prospects for creating such a program? That will be the topic of the third panel. We're really pleased to have with us a distinguished group of panelists from the U.S. and abroad. We've asked the speakers to keep their presentations fairly short, so we'll have plenty of time for discussion. And after the third panel, we'll have some time for wrap-up and thoughts about future steps for both research and perhaps for action. Before turning over the podium to the moderator of the first panel, I'd like to thank my co-sponsors here at the Wilson Center, representing our neighbors to the north and the south, the Canada Institute, directed by David Biet, who's sitting over there, and the Mexico Institute, directed by Andrew Seeley, who I hope will be joining us later. I'd also like to thank the Riksbanken of Stockholm, whose generous financial support has made this conference possible. Let me now introduce the moderator of the first panel, Tamara Warby, who will then introduce her panelists. Tamara is an economist who teaches at Towson University in Maryland and also at SAIS here in D.C., and her specialty is immigration economics. So, Tamara.
Good morning, everybody. I thought it was rather interesting, as if some of you were coming through the courtyard today, you saw the band, and no, it wasn't a Canadian group. It was actually Customs and Border Enforcement, so that already set the tone for us. I think it's a fascinating undertaking. We'll look forward to the end of the day when we see what kind of conclusions we come to, and whether, in fact, geography, distance, political will, differences in civil society carry over into making these applicable models for the United States. So the first person that I'm going to be introducing is Monica Boyd. She's professor of sociology at the University of Toronto. She's very well published in terms of Canadian and international migration issues. And I will let each speaker speak 20 minutes. Then I have a 10-minute, 5-minute, 2-minute, please stop set of nicely things prepared for me by Emily, I think. Thank you.
Thank you, and I want to thank Sonia for organizing this conference, as well as the Canada Institute and the Mexico Institute for funding this. It's a pleasure to be here, and those of you who've seen the program know that we're going to learn a lot today, and those kinds of symposiums are always wonderful to be part of. What I'm going to talk about today is entering the back door, foreign care workers in Canada. The title is, in fact, a double entendre. For those of you who grew up in post-war Canada or America and watched middle-class women have help, you know that one of the cultural norms was that help did not enter through the front door. They entered through the back door. The back door also refers to the way in which policies of recruiting care workers have evolved in Canada. In many instances, people come in on a temporary basis and then regularize their status into permanent residency at a later point in time. So what I'm going to do today is talk about the current policy regimes regarding care work. I'm going to talk about some of the current trends, and I'm going to talk about some of the policy responses to what are seen as ongoing problems. In order to do that, I want to give you a little bit of a history of the Canadian migration policy, which is rather different from the American. And in fact, advocates, as Sonia pointed out, there's a clear debate, sometimes highly polarized in the United States, on how to manage migration. And sometimes Canada is used by certain groups as the ideal and discarded by others. There are basically two major pillars that geared up the immigration policy: that of permanent admissions, which is based on three major classifications for entry, criteria of admissibility, and that is economic, humanitarian, and family reunification. Increasingly, since the mid-1990s, Canada has deliberately, the Canadian federal government has deliberately moved in the direction of privileging economic migrants. Economic migrants, again, have several classifications in them, but the major one is skilled workers. Those of you who are familiar with the Canadian point system, that is what applies to the skilled worker category. There is also another category that I'll come back to called provincial nominees, which is relatively new. It started in the early 2000s. It actually started mid-1990s, but really didn't get seized by the provinces, where provinces can select and say, we want this person, and ask the Citizenship and Immigration Branch, which is equivalent to Homeland Security, to admit this person, provided they go and reside in the province. Needless to say, there's no legislation that says these persons have to remain there forever, and indeed there is some movement. There's increasing labor market-oriented selection policy. In 2010, to give you an example, 67%, over two-thirds of Canada's immigrants who were permanent residents who arrived in that year came through as economic migrants. Now, when you take principal applicants, that is, those people on whom the visa is actually given to, of course, it's less than 67%. But the reality is, between these principal applicants and their families, over two-thirds of our policies now are recruiting people who are coming in on the basis of labor market contributions. The provincial nominees has also meant a devolution to the provinces of some decision-making, because the provinces now can decide what component of their economic migrants they want to approve of. There's also a second thing that's been going on, and really going on tremendously, which is this increasing reliance on short-term temporary labor. And indeed, it's reached the point, if you can read, this is a chart that sort of separates those of us over 50 from those of us under 50. But if you can look essentially at the pink line, you'll see that that's for the number of permanent residents who have entered in any given year. That is flow data. Temporary workers are a problem of enumeration because, in fact, they can get, within a single year, they can get multiple visas. You know, Mick Jagger comes in, he's considered a temporary migrant. He comes back 6 months later, he gets another temporary visa. And so what I've done to try to make the data a bit more comparable is to actually work with what is stock data as of December of any given year for temporary workers. But you'll see, and that's represented by the blue line, you'll see that it's increasing and indeed crossed over around 2008. So we have essentially a very, very extensive temporary worker program, in addition to other kinds of temporary migrants like students or people who are claiming refugee status, refugee claimants. Female migrants are embedded in these trends. And I want to talk briefly about two of them. One of them is the nurses. Nurses can come in under the skilled working class as permanent residents. They can also come in if sponsored through the provinces as provincial nominees, and that's again a permanent resident status, but they are also increasingly a growing part of temporary admissions. There is a class called the Canadian Experience Class that was started in September 2008, to which skilled workers, including these nurses, can apply to regularize their status as permanent residents after 2 years of work experience in Canada. And this is a very relatively new thing, as we'll see. But the main care work stream has and remains people who enter under what is called now the Live-In Caregiver Program that I'll be discussing briefly, and come in as babysitters and domestics. It's a back door again, because after meeting certain criteria, they can apply for permanent admissibility. And this program, as well as the temporary admissions of nurses through the Canadian Experience class, really are rather unusual. Virtually no other nation has this. Female caregivers are of interest because, of course, the historical legacy. There's a gender regime in which women historically have been recruited to give care, going back to the 1800s. Canadian women were very active in ensuring that a ready supply of domestics, ideally from the UK, would come and ultimately serve as domestics but reproduce the next generation through marriage. Today we have a rather different set of conditions in which the female labor force increases, the child care crunch, and the population aging has produced a care deficit, and indeed a demand for a particular a range of services ranging from babysitters to care of the elderly. And of course, one of the issues that has to be recognized in any discussion of care is the active involvement of the sending countries. Demand is not necessarily sufficient. You have to have supply, you have to have state activities that produce this supply and indeed create conditions under which the supply will leave. The best example of this, of course, is the Philippines, that has a very active policy of exporting people. And indeed, the comment has been made that their major source of livelihood through, not the major, but that a very important component of the economy, representing about 9 to 10% of the gross national product, is through the remittances that come with the export of people. So what are the policy options for Canada? How to manage care? I'd like to suggest to you that the notion of importing healthcare workers, and again, like the United States, about a quarter of people who work in what we call direct health or direct care are immigrants. Is essentially that the policy levers have been put in place to continue to import healthcare workers in the form of doctors, but in the case of female healthcare workers, primarily nurses, and live-in care workers. These programs are continuing. The emphasis most recently has been on dealing with the more problematic aspects, rather than a move away from the programs, in short, of making sure that the more problematic aspects have some resolution. Briefly talking about the nurses, essentially you'll see just from this chart that, and this is relatively new, that the temporary inflow, although very small, is still much greater than the actual number who are coming in as permanent residents. LMO refers to something which is called labor market opinion. It's very similar to what I think used to be and may still be what the Department of Labor here does, which is to essentially assess an employer's agreement that they want to hire a given individual currently outside the country, and to assess it against whether there are people already in the country, either the native-born or the Canadian-born, who can fill those positions. However, again, the major source of care workers remains babysitters, nannies, parent helpers. They rank number one in the top 10 LMOs that were granted in any particular year, and these are some of the figures. Now, these figures these are taken from Human Resources and Skills Development Canada, that has to sort of certify that there are no available Canadians for these kinds of employment positions, and not everybody who applies for an LMO actually shows up, and we'll see some differences in figures in a minute. You'll see a decline in 2009, which is reverse ordered at the top. This particular chart is essentially the numbers of annual entries of temporary workers in the live-in caregiver program. And again, you'll see that decline. It starts around 2007 and goes to 2009. We don't really have a very good reason why it's declining, so if any of you have insights, I would love to hear them. And it is a very small, it's a significant share because it really occupies the public attention as a result of issues concerning human rights and potential abuse. But it's a very small proportion of the overall temporary foreign workers that come in a variety of ways, the nurses, but also oil cap riggers, Mick Jaggers, and so on. It represented about 8%, that's the peak in 2007, and has declined down to about a little over 5% now. Well, I've been talking about the Live-In Caregiver program, and some of you may be thinking, what is this? It obviously has to do with importing people for care, and it is disproportionately women, although interestingly enough, more and more men are coming in this. The proportion female has declined from around 98% during the 90s to about 94-95% today. The Live-In Care program, as it's called, is really an evolution of several programs and recruitment schemes that, if you really want to start talking about it, go back to the 1910s. The major, more recent ones have been the Employment Authorization Program that started in the 1970s, was replaced by the Foreign Domestic Worker Program in the 1980s, and finally the Live-In Caregiver Program since 1992. In order to get in, a would-be caregiver has to have those, meet those criteria that you see on the board, and most importantly, must live in the home of the employer. The Human Development and Skills argues that, in fact, there are adequate supplies of caregiving outside the home that have been met through the recruitment of immigrants as permanent residents as well as people who have been born in Canada, but that, in fact, very few workers want to live in the home of the employers, and it is that particular criteria that governs the lives of these women who enter Canada. Entering Canada through the back door is very popular because it is associated with the elusive goal for many of these workers of actually gaining permanent resident status. And it has been likened to a form by people who are critical of it, and there is much to be critical, as a form of really essentially indentured labor, that you agree to a certain number of conditions, primarily living in the home, so that you will then be able to go to a citizenship and immigration representative and acquire permanent residency in the United States. The Live-In Caregiver worker, the main thing is the Live-In Caregiver worker is required to now work 24 months in a period of 3 years in the home as a domestic employee, which can include many, many functions ranging from housekeeping to child care to elder care. This is an example of the number of people who have taken advantage of this. Again, it's relatively small, keeping in mind that the numbers themselves of people coming in for temporary work is small as well. In 2010, for example, nearly 8,000 primary applicants, that is people who had worked in homes as domestic workers, came into Canada, but you have to say 8,000 against a total volume of 285,000 people coming into Canada that year. So it's small, but is an interesting example of how care is both recruited and managed in Canada. There are recent initiatives that have to do with persisting problems of this program. This program can be seen as a win-win situation because people get caregivers, but also the caregivers themselves can regularize their status. I mean, I shouldn't be using the term regularize because that's used in the United States to talk about illegals becoming essentially legal residents, but I'm using it here in the context of saying that they can apply for permanent resident status. And there seem to be sort of 5 problems associated, or not seem to be, there are 5 problems that have at least gotten some federal government policy changes involved. One of the major issues has been regulating recruitment agencies and immigration counselors. Recruitment agencies are very important in matching would-be caregivers most of whom incidentally come from the Philippines. About 90 to 94% come from the Philippines. So again, the active agency of the sending state is very clearly seen. But there have been cases, very well-known cases, where immigration counselors would take money for information that could be accessed on the web, where recruitment agencies would essentially get into the business of getting a ready supply of workers already landed in Canada, but that the worker would land and then be told, well, their employer didn't want them, and would be told that they had to work for the recruitment agency cleaning houses, or told that they had to do other kinds of research by the owner of the recruitment agency, a lot of abuses. And that now has been tightened up with March 2011 legislation. Unscrupulous employers is really the catch-all term for what kinds of abuse can occur when it's hidden in the household. Essentially psychological abuse, the personalistic relationships of the boss, the never-ending day, and of course sexual abuse, some of which is documented. I do want to emphasize there are many cases in which live-in caregivers are treated well, but there are also instances well documented where abuse occurs. There, essentially, the provinces, interestingly enough, and the dilemma here is that although the federal government admits people into Canada, the labor legislation, which governs the conditions of work and the rights of the worker, are provincial. And so the provinces have to take a particular role in governing these. And various provinces, including Saskatchewan, Alberta, Ontario, have now enacted legislation that makes it much more easy for care workers who are abused in the home to draw attention to their plight and to get remedial action. The transition to a permanent status has been always a source of problem for the live-in caregiver workers, and even though it's 24 months within a 3-year period, it makes many caregivers reluctant to change employees. That is, if they're in a situation where something is breaking down, or the employer, in fact, says, well, you know, Billy is now 8, I really don't need you anymore, that person has to be back on the job market, has to find new employment. And usually there is a transition. Anybody who's looking for work, you know that it can take 2 to 3 to 4 months. And so even that combined with maybe a trip back home can really place the caregiver up against this 3-year limit, even though it seems generous. So the government has recently done a longer time frame, a 4-year limit instead of 3, and also said, well, you can accumulate instead of months, 24 months, you can do it in terms of hours, in 3,900 hours within a 12-month period. A fourth and fifth problem come with the transition to permanent status, and then the fifth problem is the settlement consequences. The transition to permanent status is not always easy. And one of the big gaps in the past has been in addition, I guess there are really 4. I shouldn't have said 5, but there are 4 problems, because part of the transition to permanent status has involved, in addition to the longer time frame, the medical exams that are required. All workers are required to have a medical exam before they become temporary workers, but they're also required to have a second medical exam when they apply for permanent resident status. And in a couple of instances, the women have learned that they have a disease that would be very costly to the state. In particular, this is going to show I can't speak Spanish. Wahana Tejada? How do you? Tejada, okay. Discovered, was a Filipino nurse, discovered in her second medical exam for permanent residency status that she had breast cancer. She was ordered to go back to the Philippines, presumably to die. There was a huge uproar by NGO groups, non-governmental organizations, which are very proactive on the part of live-in caregivers in Canada, and a law was changed that would allow, in these exceptional cases, for the person to be granted residency in Canada on humanitarian grounds, and therefore to receive medical treatment and to remain a permanent resident. There are additional settlement consequences, I think some of which we'll hear about later on. Family reunification, and these settlement consequences have not really gotten much policy levers applied to them, which tends to be the case, I think, in the United States as well. Family reunification, it's estimated that some of these caregiver workers are separated from their families for up to 10 years as they go through a process of trying to get residency in Canada, bringing their families over. And like the United States, there are wait lists of people trying to get in. We don't have quotas, but we call them sort of caps, which amounts to the same thing. And then another issue that's very important is what has been seen as I should say also the family reunification plays out in two dimensions, what I call the lost children, the children that are coming over at age 12 to 15 to rejoin their families, expecting streets of gold because the remittances the parents have given them have always been used to improve their standard of living back home. And then they suddenly discover the tremendous difference in the school system, that their English, if they speak English at all, is subject to ridicule by their fellow students, et cetera, et cetera. Elder care also is a problem. The other issue is that of de-skilling. You have to remember, and I guess I should have pointed out, that increasingly the profile of care workers in Canada is getting to be very, very highly educated. This is the proportion of live-in caregiver workers in the temporary program who have a university degree or higher. It's at around 64, 63% in the last couple of years. And if you look at this chart, the blue is essentially all permanent residents coming in. It's the proportion university again. The purple is the live-in caregiver workers, and the yellow is the skilled workers, those who are recruited on the basis of their labor market contribution. And you'll see that recently it's been increasing. The education of the live-in caregiver workers has increased because, in fact, what we're getting now, it's through the back door. We're getting a number of people who are trained as engineers, as nurses, as teachers, who are seeking their way into Canada by living as caregiver workers and meeting this 24 months, 3,900 hours within a 4-year period. So what are the policy messages? Well, for migrant care workers, the human rights discourse and the civil associations, the NGOs, are very important given the period of tenure that they have to undertake living in the home. And Canada has, in fact, a very proactive national or NGO group. And the de-skilling issues are important because, of course, what's happening is if you have engineers, actually it wouldn't be engineers per se, but it would be probably teachers and nurses who are coming in with university degrees but are not working for 2 to 4 years as that, they end up getting de-skilled, and it makes it very difficult for them then to pass the provincial regulations that govern the conditions of receiving employment in the field for which they originally trained. For the sending countries, the argument is essentially that there is a continued export of people, a continued reliance on remittances, a topic that has its own internal debates that perhaps we can touch on. And in fact, in the receiving countries, I want to point out that Canada is unique in allowing this status change, and we need to ask what conditions would be needed in other countries. Apropos to the United States, I want to conclude with this question, which is simply to say the political system is without question incredibly important. Canada has a parliamentary system in which parties in power can change legislation quite easily. The congressional system that one has in the United States, as we heard from Sonia and other experts in the room, has led to a real gridlock in which very little can happen because you can't get a consensus. It's a highly polarized system. In Canada, things work for better or worse because, in fact, the party in power can say, we're going to do this. We have the votes. We can. And well, I'll leave you with those thoughts. And I also want to say this issue is not going to go away, however, because of the aging population. So thank you very much for your attention.
Thanks very much, Monica, for such an insightful and thoughtful piece, and it'll be interesting to see now that Canada has finally a majority government, how immigration policy might change. Our next speaker will look at Germany and the European Union, and our next speaker is Helma Lutz, and she is Professor of Women and Gender Studies in Frankfurt at Goethe University. And we'll find her PowerPoint first.
Good morning. I'm very happy to be here and thankful to Sonia that she invited me. We are having meetings. We have had meetings in Europe in different places before this, so I'm really excited to be in the States this time and talk about German-speaking Europe, which is a bit. What is it? This one?
Go to the right.
Okay. Which is a bit of a difficult task because German-speaking Europe includes the two countries I will actually speak about, which is Germany and Austria. But there's also Luxembourg, there's Switzerland, there's parts of Belgium speak German. So I have actually decided that I will speak about the two countries that are part of the European Union, and I'll leave out the other ones in the discussion. Actually, if people want to know, I can also speak about them. Okay, so what I will do is, first of all, give you a bit of a background about what is this Europe and this German-speaking Europe, and especially the patchwork of legislation we have. Then I will speak about the types of migrant care work, and actually I will not speak, I mean there are very, up to now, no programs like Monica talked about in Canada, the nurse recruitment programs. We have had them, but they are not the important ones at the moment for this whole area. I will be speaking about care work in the homes, right? So this is the big labor market at the moment, and I will tell you why. This is domestic work, childcare, and elderly care. Then I will speak a bit about the intersection between the care, welfare, and migration regimes, also about the legal situation, and then I'll come to the debate. Okay, so just shortly about Europe. I mean, maybe from the American part, this is not the case, but from within Europe, we have a patchwork rug of different European countries. So we have the EU members and the non-EU members, like Switzerland is not an EU member state, but we have the also harmonization of legislation which is going on. And it's interesting that partially, I mean, the idea of the European Union was, of course, to have economic power to establish that and to have economic harmonization. But we have also had now for some time the legislation on social rights agreements, anti-discrimination legislation, things like that. But we still have, and this is, I think, very interesting, few sanctions on national states' dealings with migration. So, we will come back to that, I think, in the discussion. Okay, so to give you an idea about the countries I'm speaking about, Germany has 80 million people and Austria 8 million. They have, these countries have a lot in common, but of course there are also differences. When we look at the care sector, we can say that in Germany now for a long time, which is about the last 10 to 15 years, we have a huge demand for migrant care workers, while there is political ignorance of this fact, the ignorance of the deficit. We have on the demand side the demand for people working in as home carers has been going up for a long time. But the restrictive migration policies, and this is due to the fact that the countries I'm speaking about, but also many other European countries, now have been turning to what Monica also called the managing migration, and the migration that is welcome is that of highly qualified people, and care work is not considered highly qualified work. So here we have policies, restrictive migration policies that have resulted in a large sector of undeclared work. So the consequence is actually the situation in Germany and Austria at the moment is that on the one side we have sound welfare state proficiencies, we have care services, we have of course kindergartens and all kinds of services that are important for this issue, but we have side by side now the existence of an irregular market of migrant care work. So when we can speak roughly about three types of care work. One is domestic work, which is the cleaning, ironing, cooking, and so forth. And we know from numbers, and here it is to say, I mean, I'm quite jealous of the fact that Monica had this very good research results on how many people are we speaking about, but in both countries I'm speaking about, we have very bad data. So we have roughly 1 in 10 households in Germany is employing domestic workers. In Austria, it's 20%, and for this kind of work, we can say that it's mostly irregular work. The majority of the people have no contract. So a lot of migrants, there's a huge number of migrants working in this area in this work area, and so they work in different households over the week, like 30 to 50 hours a week, cleaning different households and cooking and caring. We have the service check system in both countries, but there is a very low level of take-up, which is, I think we can also discuss that later. Then we have the child care, and of course this exists next to creches and kindergartens, and the creche situation, for instance, in Germany is not very good, but middle-class parents, two earners in the family, have in both countries used the au pair system, and this is the live-in system, in order to find some way out of problems with childcare. So on the I mean, there have been a couple of legal regulations. So an au pair can only stay there has a contract for a year, and there's a new protection scheme. But still, I mean, we also know of lots of cases where au pairs are exploited and work more hours than they are supposed to work according to the contract. 70%, and this is interesting, I think originate from outside Europe, and the majority of the Europeans are from Eastern Europe. Eastern Europe is really for Western Europe, especially for Germany and Austria, the resource countries, the sending countries for migrant domestic workers. Then the next type is the elderly long-term care, and this is the live-in program or the live-in type of care work, which also Monica talked about. And I think this is really the sector that is going to be important for our future discussions. Also, the whole question of aging population, I mean, is the same in Europe. So here we speak about 24 hours personal care workers. And it's interesting, I mean, what is now called the circular migration scheme is something that was that originated in self-organized system, so that migrants, for instance, from Poland came for 6 to 10 weeks on a rotation scheme so in order to be able to balance their obligations, their family obligations at home, with their work obligations. So they took turns with friends, with sisters, with other people. So they came in for 3 months and still do that actually. But we had that as a self-organized system, and especially now on the regulated system, which is at the moment one which is especially relevant for Austria. This is now also put into the regulation so that 2 people can take turns. Okay, so in Germany we have, it's interesting, we have really, as I said, bad data, but there is an estimation of 150,000 migrants working irregular in the household. And there is also, and this is a sound number of these 3,000 working regularly on a scheme which is very complicated and has a lot of negative aspects. I will speak about this later. Okay, so the majority of them come from Eastern Europe. You see the countries, and when we ask ourselves, I mean, what is really happening here, we see that in both countries we have a very familialistic care regime which gives priority to kin care, and which usually means females in the family. So I think one of our colleagues will speak about this thing is very important in other countries as well, as a cultural coding, right? So that the youngest daughter in the family or somebody is doing the care for the parents. We have in Germany, and we have been asking ourselves, why is there such a low number for the regular program and such a high number for the in the irregular estimations? And there we can see that the key role here is the care allowances paid to family members. So in order to keep this idea of a kin care system, people in the family get money for caring for their parents, for the people in need of care. So the model which is interesting, I think, for the United States debate is the one that is that Austria has established since 2007, which is a so-called self-employment, but which means that the state is paying directly to the care worker for elderly people the money, plus also social protection coverage and health and retirement work. This is a model, I think, which visualizes what's happening. You see the migrant in the family, so it's really it's not the market and the state that takes so much. Well, the state is as I wanted to show here, the state in Germany is really compliant in a way that, on the one hand, there's a restrictive migration policy, so the door is closed, but on the other hand, the state is compliant by actually turning a blind eye on this highly irregular sector. So when this is maybe far too complicated to also to see for you, probably it's not so easy. But what I want to show is, when you look at the right at the left-hand side, you see that there are 1.45 million people in home care, and the care allowance that is allotted to family members is in this area. So for these people, the state pays a care allowance, and it is argued that it goes directly to the person that is in need of care. But we know that 40% of all family members who get the care allowance are full-time employees. So what they do is outsource their money they are getting to a migrant worker. So in a way, this is the reason why I call this complicity, because the state actually pays these irregular workers. This means for our debate that we call this system cash for care, right? So what is problematic and what is good about it? On the one hand, you can say what is problematic is that the care receiver is the employer, and that's quite in a situation where you have quite an intimate relationship. This can become precarious easily. In Austria, this regularization as self-employment is a good thing, and it's very interesting that at the moment in Germany the Austrian model is discussed as a new model we should take over. But there are no working time regulations, there are low hourly wages, there's a lack of rules on workers' and clients' protection, and of course there's exploitation and discrimination. So in Germany, we have this, what I called the open secret, the tacit toleration of irregularity, and the state compliance with irregularity, but this idea of calling this semi-compliant, this comes from two colleagues from Oxford, and they say that actually this is a way of the state to solve deficits in the market flexibly. So in a way, it is not an official program, but it solved the care deficit. We have also done a research on the media coverage of this problem, because there is the most important newspapers in Germany, and this was also the case in Austria, have discussed this widely, that there's a care deficit and the state should do something about it. So, but the state hasn't, in Austria has taken up this idea, but in Germany we are still, I think we are getting there because we have to get there. So what we have now is that in both countries we have a two-sector model side by side. We have on the one hand, on the one side, the expensive regular care services, which means this is the welfare state provision, but it's very expensive because people are not working 24 hours in the household, but there are at least over the week there are at least 10 to 12 people taking, of course, up their 8 hours or their 5 hour schemes, and then they go home. But and this is why so many people choose the regularized cheap migrant care worker from Eastern Europe, the majority. Well, so the downgrading of social standards and labor rights, I think this is quite an important issue, which is also discussed in the US. And of course, the care drain in the sending countries has repercussions for staying behind parents and children. So I think in the debate, and this is because I'm a scholar who is trying to discuss gender issues and migration issues at the same time, I think we really need to look at 3 different levels, namely the individual dimension, the regime dimension, and the spatial dimension, which means that certain kinds of, the last dimension means that certain kinds of programs, like this circular migration programs, you can only have with countries that are really in the vicinity of the receiving country. Thank you very much.
Thank you. Some very nice comments and food for thought, as well as a very good lead-in to the next section. But before we start the next section, we have about 15 minutes, and I'll open up to discussions. I'm sorry, I don't know the names of all of you, so if you would just also give your name and association before you ask your questions.
Yeah, and wait for a microphone.
Okay.
Good morning, Xochitl Castañeda from the University of California, Berkeley. I have a question for Monica. You mentioned that there are some exams, medical exams, that are performed before, but I wonder if there are some that are performed after. And my question is related to the studies that we have done at UC that showed that the conditions after 5 or 10 years, the health conditions of the workers really deteriorate, not just for the type of work they perform, because usually it's in the lowest sectors of the economy, and also because they don't have access to health insurance. Being Canada, a country where health is human right, I don't know if these workers have access to health services while they are there, and is there a way to kind of regulate that they come back to their countries of origin, at least with the same quality of health that they brought when they arrive?
Okay, the medical exams that I was referring to are essentially done for administrative purposes. There are two. There is a medical exam that all temporary workers, including the live-in care workers, have to go through and pass. And then when the temporary care worker has, or the live-in care worker has satisfied the conditions of the 24 months within a 4-year period now, they have to go through what all permanent residents to Canada, would-be permanent residents to Canada, have to face, which is another medical exam. So, and those medical exams are done for administrative purposes to ensure that the state, whether it's provincial or federal, is not having to absorb the costs of people who essentially will be draining the state funds for their health needs. And we can argue about whether that's appropriate or not. The issue that you're talking about is the healthy immigrant effect, written more broadly, which is where immigrants in general in both Canada and the United States come in. They're fair, the ones that are coming in legally are quite healthy, and there is some selection usually going on, we think, for that. That is that the medical exams ensure that those who aren't healthy or who have tuberculosis are found out early and not allowed in. But what happens in Canada is that in fact, the live-in care, the health systems are managed at the provincial levels. Most of the provinces require new immigrants or temporary residents to subsidize their own health care for the first 3 months, but then they are covered by the provincial health care system. And in fact, legislation that was just tabled by the government requires employers, they've tightened up on the contracts that employers have to sign with workers. I didn't have time to go into that, but it now requires employers to pay for those first 3 months of private health insurance to cover the bridge period that these workers have to go through. There is no real study of the deteriorating health or the health level of live-in caregiver workers. I mean, it's generally thought that they do have access to health care. Clearly, some of them are in stressful situations, but we have no evidence as to whether there is actually a decline in their health, and they do have access to health care.
Hi, Kimberly Morgan from George Washington University. I'm curious, I guess in both countries, about what measures are in place to make sure, and this is building on the previous question really, to make sure that these migrant workers have access to the welfare state, to social citizenship. In the U.S., that's a huge issue where you either have people who are undocumented and can't get rights to Social Security, or who insist that the person who's employing them not pay their Social Security taxes to make them entitled to a pension, for instance. So I'm just interested in the extent to which there are measures to ensure that people who are employing these workers in their homes are actually paying whatever taxes need to be paid, or in what way this kind of intersects with the system of entitlements.
Want to do that, or should
Is there?
It's on.
Is it
It's
working?
on.
Okay. Yeah, thank you. Well, I think this is still a question which is quite important to be discussed, because on the one hand, in Austria, where it was like in Germany before, with a high percentage of irregularity in this sector. Now, with this regularization, at least retirement and Social Security money is paid, but on the basis of a salary that is really very low. So, and also, I mean, I forgot to say that, but in really contrary to the Canadian model, which gives access to Canadian citizenship after 2 or 3 years now, there's nothing like that in the German and in the Austrian case. So this is really a permanent, it's the old kind of, you could say what the model is, what in the 50s and 60s was the guest worker system and how it was invented, namely as a rotation system, right? On the other hand, I mean, what we know from all our research is that the migrant women themselves, a colleague has called that they migrate because they want to ensure that they can go home again. So they really are not. I mean, the majority is not in favor of emigrating or going to this. Staying in the country where they work. They intend to go back, but of course, what they want is to have social rights and to have citizenship rights which illegal workers do not have at all. So, the discussion is on this point actually: access to health care, access to the pension system, access. Germany especially has this incredible rule that children of irregular parents cannot go to school, cannot get education. So this is changing now at the moment, but we have been fighting for that for a long time because schools were supposed to report this to immigration office when the parents were irregular, things like that. But I mean, but I think these are the three things. I mean, the option actually to stay changes a lot. But in most of the cases where these women work in the homes, the employers do not want the families and the children to come. So this is a barrier, the restriction for these women to bring their children, for instance. So most of them know that, and what they do is, they think about care arrangements for their children back home, and they manage them also through all these our new technical possibilities through Skype and so forth and so forth. We have found Polish women who do homework every day with their children at home through Skype. So, I mean, this is a way really to connect to them. And they all of them say, well, in the first place, my aim is to go back, right? It's not to stay. But then, of course, as we know from all the immigration development studies, is that these aims change in the in over time. So of course usually they want their children to have a good education, so they want them also to come and study and have a good schooling, things like that. And also what is quite interesting is that contrary to Canada, we do not have a real public debate on this question of citizenship for this. There is really, well, it's not there. And this is because Germany, for instance, declared itself a country of immigration not even 10 years ago. So you can see that we have had these large numbers of immigrants, really millions and millions over many years, but no, we are no country of immigration, which means that the national citizens have to be protected, and the labor market and the welfare system has to be, protected. And this is, I think, still the backbone of the policy in Germany and also in Austria.
Oh, sorry. I'm sorry.
Well, I mean, I'll just say that hopefully very quickly. Much of the research that's done in Canada over the Living Caregiver Program in particular is exceptionally critical. And usually the cases of abuse are such that you can understand why that is. And there has been, most of the books that have been written are precisely on the partial citizenship that are given these workers as they are in a temporary status. And indeed, they do have full legal rights. The issue is, in a situation of asymmetrical power and dependency, do they feel comfortable in accessing those when in fact it means that the employer may fire them? And then they're into this job search situation I described. They do have full social rights, but again, how it's actually implemented is a subject of much debate. One of the major sticky points has been that when you are living in the home but not one of the family, that you are on continuous call, and that therefore you don't really get the days off that you have signed a contract for. You work more hours than you have agreed to, etc. That has actually been firmed up within about the last 2 months. And the provincial labor laws now are making workers a little more comfortable in coming forward and saying, well, we have this contract, you're violating it. But it still remains a sticky point. In terms of social rights, they definitely cannot have family members in the country. A few may have them in there illegally, but you cannot bring family members over unless you are a permanent resident, and that leads to the family unification issues I talked about. They do not have political rights in the sense of voting. The citizenship issue in terms of, what are they getting out of the system? They are required to pay into the Canadian unemployment insurance and into the Canadian pension system. And some of the debate is about the fact that if they go back to the home country, they don't get those pension payments returned to them. But the Canadian government, the estimates on how many essentially get a permanent resident status, the critics say that it's no more than 50%. The Canadian government, looking at recent statistics, has argued that about 90 to 95% of the living caregiver workers in fact transition into permanent resident status. So they do get those pensions if they do that. The big issue is the low salaries that's associated with the gender regimes. An estimate in 2007 found that after the care workers paid these taxes, as well as a modest living allowance that the employer can ask for. The employer can ask for between $50 to $80 a month for housing and so on. That the workers are netting, and these are 2007 figures, are netting about $10.45 per hour, which is not an awful lot, particularly if you're trying to send remittances home. Thank you.
Okay, we have time for one last question. No?
Hi, my name is Tori Hester. I'm from Roanoke College. This question is for Monica Boyd, and I just wanted a little bit more on the de-skilling and the transition to legal permanent residence, and if there are formal programs or informal social networks that help many of these women gain professionals, what is the word I'm looking for? If they've been trained as nurses, get their certification on the ground?
Mm-hmm. The issue of what is called the accreditation issues of people who have trained outside the country is a huge issue in Canada. You can appreciate the fact that if 67% of all immigrants entering a country are coming in the economic class, you've got a large number of professionals. And indeed, it transcends the skilled caregiver program. But what is emerging as an issue in the living caregiver program that I alluded to earlier is that we are now seemingly getting a high proportion of nurses coming in because they can meet the criteria. The living caregiver program per se really reflects the Filipino diaspora. Interestingly enough, many of them come from Hong Kong, where they go first to Hong Kong and then they come to Canada. And that group is actually quite well organized. There have been some very, very active NGO groups on their behalf. Like many of the Filipino workers in Europe, in Rome and in Israel as well, they're active social networks. However, the main problem for the reaccreditation is that you have to satisfy the province's mandate to the professional associations to certify people in key professional areas such as engineering, health, for reasons of public safety. And these associations really do demand that the person looks like a Canadian in their training. So whereas you might be trained as a nurse dealing with tropical diseases, the argument is going to be that, well, you really need to understand the technology in Canadian medical care. You need to understand the geriatrics of nursing. And it is a long, slow process. And I actually, in my other lives, and I have many, but in my other lives, I actually work on this area of foreign credentialism. And it's a huge problem. What seems to be the case more generally is that people end up saying we're doing it for their children. They don't get, the mismatch is quite large.
Okay, thank you both for a very informative session and a great start to the morning. So we'll go now to the next session.
Usable chairs.